A troubling trend is emerging. More children are facing life-threatening flu complications as vaccination rates drop, according to the CDC. Christine Ware's voice trembles as she speaks about the upcoming flu season. Anxieties are high, she says. We're trying to navigate what life should look like without being in a bubble. Ware's 4-year-old son, Beckett, is still recovering from the flu he contracted in January. Within a week of infection, he became extremely lethargic, unable to move his head or arms, eat or speak. Ware, a mother from River Forest, Illinois, knew the problem. It was the second time Beckett had developed acute necrotizing encephalopathy, ANE, a rare brain condition linked to the flu. This time, recovery has been slower. It has taken longer for his brain to recover, she says. The first time Beckett was diagnosed with ANE in September 2022, he hadn't received his annual flu shot. The second time, he had it. But evidence suggests the vaccine may not be as effective for children who've already experienced flu-related brain inflammation. Cases of pediatric ANE and other flu-induced encephalopathies are rising. During the 2024-25 flu season, 109 children were diagnosed with the rare complication, according to new CDC data. Of those, 84% had not been vaccinated. This comes as the nation logged 280 pediatric flu deaths last year, the deadliest since the 2009-10 H1N1 pandemic, while flu vaccination rates for children have fallen. Dr. Buddy Creech, a pediatric infectious disease specialist, emphasizes that we don't always know how to predict which kids will face the most severe flu complications. That's why we recommend the vaccine for everyone. It's a misconception to believe only sickly children are at risk. ANE, though rare, just a handful of cases annually, has never been formally tracked. However, doctors are noticing an uptick in severe brain inflammation cases among children post-flu. Flu-associated encephalopathy, IAE, occurs when the virus attacks the nervous system, causing symptoms like confusion, difficulty walking, hallucinations, and seizures. Dr. Molly Wilson Murphy, a pediatric neurologist, suspects there are at least 7 forms of IAE, with ANE accounting for about a third of cases. Of the 109 children diagnosed, 74% were in the ICU, 54% on ventilators, 55% previously healthy, and 19% died. Flu is dangerous for children, period, says Dr. Keith Van Haren, a co-author of the study. That is not a mischaracterization. Seasonal flu shots are less effective at preventing infections than vaccines like MMR, but they reduce the risk of severe complications and death. Last year, the flu shot was up to 78% effective in keeping kids out of the hospital. Yet, 90% of the 280 children who died last season hadn't been vaccinated. The best way to protect yourself and your family is for everyone to get vaccinated, says Dr. Sean O'Leary, an infectious diseases expert. In the Southern Hemisphere, the vaccine has halved flu-related hospitalizations, but U.S. vaccination rates have dropped. Fewer than half of children, 49.2%, got their shots last year, down from 62.4% in 2019-20. Reasons for the decline include vaccine hesitancy and access issues. Many families struggle to get care, and clinics face staffing shortages, says O'Leary. This is a complex issue. For vulnerable children like Beckett, vaccination is critical. It's easy not to worry when it doesn't directly affect your family, says Ware, but vaccination is a simple way to protect my son. As the flu season looms, the question remains, will we prioritize prevention over reaction? What do you think? Share your thoughts in the comments.